an epiphany, moment of clarity. I was blind before, but now my eyes can see. I know my destiny, I'm open mentally. My spirit is ready for the awakening.
Feel the healing, what they are working on at the moment. And if you do nothing else, have a conversation with your GP at some point. They are destroying general practice. At the moment, a GP's income comes with his patient list. So I've got 5,000 patients. For every patient, let's say my practice gets £100, right? So the budget stays with the list. What these reforms will do over time is to remove the list from the GP and put it with the network, primary care network, these new organisations. Once the primary care network has got control of the budget, you no longer need the GP. And if you see what's happened in out of hours GP care, you've gone from a GP cooperative, so when you're sick you'd see a highly qualified person, to NHS Direct, a helpline run by nurses, to 111, a helpline run by school leavers. Right? That's going to be the same for the rest of general practice. So in a few years' time, for you to rock up to your GP and say, I need to see a doctor, no chance. The receptionist, who's untrained, will decide who you see. Whether you go and see a pharmacist, you go and see a physiotherapist, you go and see a physician's associate. GPs are not welcome. Doctors are not welcome in the new system because doctors tend to drive up cost because they want to look after the patient. Yeah? So the more doctors you can drive out of the system, the more money you can make. Yeah? This is called downskilling. Replace expensive staff with cheaper staff. What's the problem? The blind spot. If you're a GP, 5 years medical school, another 5 years after medical school, you don't know everything, but you know a little bit about a lot of things, and you've got a small blind spot. The less qualified the person, the bigger blind spot. What does a blind spot mean? Patients dying. That's what the blind spot means. I'll give you an example. So you're a 23-year-old lady, you go to the GP, you say, I've got shoulder pain. The untrained receptionist says, I know who you need to see. You need to see our physiotherapist. Anybody disagree with that? It's reasonable? Who said that? That's not fair. Nobody heard him. I'll explain it to you. A lady of that age presenting with shoulder pain could be related to internal bleeding, irritating the diaphragm, which shares the same nerve supply as your shoulder. So she could go to the physiotherapist and collapse on the floor and bleed to death. That's what de-skilling is all about. Increasing the risk to the patient, making more money for the private provider. Who's not depressed enough? So, what have I been working on? Myself and a colleague of mine, Drew McFadden, we've been working for the last couple of years. We've produced a film which explains all of this. We've been to America. We've also uncovered how their system works. And we reveal how we're going to get to the end game unless a lot more people like yourselves start to get active, educate yourselves, educate others. If you haven't got a card, there's some at the back and there's some at the front here. The film's called The Great NHS Heist. We need as much help as possible for people to spread the word. There's more you can do, you don't have to take my word for it. The books I've got up on screen here will give you a very good picture. If you're going to only read 2 books, it'll be the top 2. The Plot Against the NHS, written 4 or 5 years ago, and Deadly Spin, which explains the corruption which is endemic within the American insurance industry, and the author we also interview in our film, Wendell Potter. Propaganda Blitz explains how corporate media is really there just to control people's understanding of the world. And Democracy in Chains explains the transatlantic flow of dark money and think tanks and other outlets for their money, such as social media advertising and all that sort of thing, which I won't go into. So, I was watching something and listening to something on the way here. There's a man called Ralph Nader who stood for president in the mid-2000s in the States. He more or less single-handedly managed to introduce safety legislation in America in the 60s, car safety and environmental safety he pushed. And one thing he repeatedly says, in order to achieve change, you do not need 99% of the public to wake up. You need around 1% of dedicated people to make social change. And hopefully what I'm doing is giving you the equipment to be that 1%.
Thanks, Bob. Thanks, everyone. I think you'll agree that was an absolute tour de force. It's a truly horrific and terrifying picture when you look at it. But don't forget that what you're looking at is the glory of free market enterprise. Health is a peculiar topic, isn't it? We all feel we have a right to live. None of us do really, but we all feel that there shouldn't be a conspiracy to deny us basic healthcare that can facilitate a good and healthy life. But you know, Gordon Brown and Tony Blair had a mantra here. They kept on talking about, and it is Thatcherism, the beauty of the efficiency of the market, the efficiency of free market enterprise. When they talked about PPP, they didn't say we're going to make a killing, quite literally, but a killing in terms of profit for the big banks. They said, no, we're going to introduce the efficiency of the market into healthcare. And just as Nixon said, this is one minute he's saying this is great, we can make money and deny people health. And 24 hours later, 16 hours later, 18 hours later, he's on broadcasting to the American people, all of them, saying this is about excellent quality healthcare, and then blinking in that way that it makes you think he's absolutely lying. A bit like when Bill Clinton says, I didn't have sex with that woman. And he walks off stage. Yeah? This is what it's all about. They're absolutely fraudulent. They lie to our faces. The British ruling class is supremely cynical. They know not to tell us the truth, and that with most people, their words will be taken at face value. So they never admit the lie. The free market, of course, is very efficient. It's very efficient at making profit for a tiny number of people. United Health has managed to take over most of our NHS, control a lot of the funding, direct more and more of the money their way. Who knows about it? If I tell that to my colleagues at work, they don't know about it. I direct them towards Bob's films. Some watch it, some don't. Few do. It's very hard to swallow and to accept, but it's happening to us now. The free market is excellent at making money, but it can't make money out of the poor. Free market fundamentalist capitalism is excellent at making poor people. So they're in the rub. There's actually billions of people, more than half the world's planet we know, have less wealth than the richest 6 individuals on Earth. So those 6 individuals have got all the money and they're searching away around the world thinking, how can I make more money? But you can't make money out of the poor. They've got nothing more you can take from them. They're already marginalised enough. And that's the problem with the NHS. NHS has got all this money, all this beautiful tax money, just at the time when people are looking for profitable investments. Of course we have to take advantage of it. But you don't waste so much of that money providing healthcare to the poor. You know, you can run health services and make a lot of money, providing you tailor your services, giving too much healthcare to the rich. It's something Bob didn't touch on this time, but there are instances literally of healthcare organisations giving unnecessary heart operations. Perhaps proving that half the heart operations they're delivering are unnecessary in the United States. They're taking people who don't need operations, subjecting them to major surgeries, massive, grievous bodily harm upon those people. So on the one hand, unnecessary, expensive care to people who don't need it. On the other hand, neglecting the health care of literally, in our country, millions, and across the world, billions. But we don't hear about the 120,000 people who are dying on waiting lists because of the privatisation and cuts within the NHS. There's no headline, but there's wall-to-wall headline about coronavirus, of which until yesterday there were no people suffering from that disease in this country. Because it's useful propaganda against China, and at times being a total distraction. And when you hear people, of course the NHS is ready for any epidemic that comes. NHS is run down to the point that Bob can't get people out of the surgery into the hospital. I have people on my waiting list that I can't get onto operating lists. I have people having second strokes waiting for their carotid endarterectomy. When I've diagnosed them, I know what I want to do to them. I just can't get them on a list in a timely fashion to have the operation done. You know, and we're not supposed to speak out about these things. People don't want to hear it. You can get yourself in trouble. Your career will suffer, your job will suffer. Well, it's time that we built an organisation that can put the case not for the very, very wealthy, but for the working people. You should see his film Sell-Off. You should see his film The Great NHS Heist if you haven't already. You should use them to disseminate this information because it's extremely powerful, and it should be a key part of the message that the Workers' Party of Britain is taking to the British people. Labour will not save your NHS any more than the Tories will. And it's not just about Boris selling it to Trump. This is something that's been happening over 40 years. It's very joined up, and it's something that we need to be very explicit about. So I'll take one question from that lady there.
I don't think there won't be a magic flip over. It'll be a drift of the middle class out of the NHS, and you're talking of a drift over 2 or 3 years. They will certainly try and do as much of the structural change that's left to do in the early part of this Parliament. And I think there's talk about legislating for under health inflation budgets for the NHS for the term of this Parliament. So they want to put into law defunding the NHS. One slide I didn't show you, which is a worry, and I will show you because I think it's relevant, is what Simon Stevens needs to do in order to pool the budgets. He needs to have a part of the Health and Social Care Act repealed, which is called Section 75. At the moment, perversely, Section 75 protects the NHS from private monopoly within the NHS. It forces everything to be tendered out, but that's open and we can scrutinise it. By removing Section 75, that will be done behind closed doors without public scrutiny. And the most perverse thing about it is look who Simon Stevens has got calling for the reversal or the scrapping of Section 75. The GMB union. Keep our NHS public. We own it. And a think tank called CHPI. The very organisations supposedly protecting the NHS are calling for a bit of the legislation to change which will enable American-style HMOs. You couldn't make it up. And that's why we all need to become a bit more informed about the detail. We need to arrange an exchange program with the French unions. Unfortunately, our health unions are captured. There's no other way to put it. They have significant funds, significant manpower. Why aren't they putting this out? What's the problem? The problem is they're right wing of the Labour Party, aren't they? They're Blairite, or they're ignorant. Either way, they're not doing a good job. But I think there's an important role for grassroots union members to put pressure on upward and challenge their local leaders and national leaders. Why aren't you telling us about this? It needs grassroots pressure upwards. And I think without that, they're a waste of time.
You asked if we were depressed. I preferred the couplet from the Blessed St. Augustine that you had on the screen. I feel anger and I feel courage, having heard you. Anger at the crime that has been committed against our finest institution. Anger at the Labour Party for its role in that, with majorities in the hundreds and a period in power of more than a decade, 13 years, in which this whole process fastened, quickened. And anger at the shadow Secretary of State for Health, Mr. Ashworth, who spent most of his time in office conspiring against Jeremy Corbyn to try and get rid of him, and was finally caught in a tape-recorded conversation with a Conservative, proving that which I had been saying for some years. I hope that everyone has been impressed enough, at least, to follow us on Twitter, follow us through our website, follow the mother of all talk shows on Sundays. I hope some of you, I hope most of you, the great Clydeside leader Willie Gallagher used to open his meetings, comrades and friends, and I hope by the end of the meeting I don't have any friends left. That sometimes happens to me, but for other reasons. I hope that most of you will have concluded that there is a space, a place, a need for the Workers' Party of Britain, and that you will join us. We'll shortly announce where our next public event will be. We're going to do one of these kinds of meetings every month throughout the course of this year, and we feel that there is a place for us. We feel that we have a perspective on things that is valuable, indeed vital. On small and large matters, we're looking for local government by-elections. We want all of you to descend on a small place somewhere where a council by-election is being fought, and we'll fight it there. There may be parliamentary by-elections. As Nye Bevan said, where there's death, there's hope. But our primary purpose in this early period is not elections. It is building an organisation of thousands of conscious, clear and dedicated people. I hope that you are the first of those. Thank you very much.
All around us is life, our humanity. Our humanity is the essence of life, our blood. Our blood nurtures its soul. Our humiliation and pain gives it expression. Our ignorance gives vision to its life.